Welcome to Midwifery and Me. This is your midwife Cynthia. Kindly subscribe, share, and watch this video to the end for more tips that have been proven. Thank you. Hello, welcome to my YouTube channel. This is Cynthia, your midwife. Okay, my channel is called Midwifery and Me. Kindly subscribe and share the videos as well as like if you like the video and the content. So basically, Midwifery and Me, we discuss maternal, child, neonatal, and adolescent reproductive health. So that's basically men and women health services. That's basically pregnancy, anything related to childbirth, labor and delivery, postpartum, under fives, clinics. We talk about immunization, or that is pertaining to MCH. We can coin it MCH and L&D. Okay, thank you so much. So I'm your nurse, Cynthia. Happy midwife nurse, Cynthia. Okay, and I welcome you all to my YouTube channel. Okay, so today we are discussing on 5 proven tips on um, maximizing your natural conception. Okay, so just to give a background, usually in our homes, we like diagnosing ourselves immediately with delay or anything. So basically, research is saying that in about 60%, people who have unprotected sexual intercourse intending to conceive, usually in within 6 months, they're likely able to conceive, and within 1 year, the chances about 80% are likely to get pregnancy rather. So on that note, we are talking about 5. So let's dive in these 5 tips. What are they? Basically, you've been doing them, but today we are here to remind each other as well as being informative. Okay, so number 1, we are talking about stress management. So why stress management? When you are ready to conceive, we need to avoid stress at all costs. Okay, why? Uh, what stress basically does, there's what we call stress hormones, mainly cortisol hormone, which will reduce the quality and the quantity of the pregnancy hormones as well as the quality of progesterone levels. Okay, so when you don't have such hormones, you have a low chances of getting pregnancy. So number 1 thing is stress management. We dive into our number 2. Okay, our number 2 point is knowing your body. Okay, basically I like saying knowing your bodies, because when we say knowing your body, coming from an African or being an African context, usually when it comes to conception, all the care, all the blame, all everything related to conception goes on the female. So talking about, you need to know your bodies. Okay, the male should know their nature or the quality of their sperms. The female should know their fertility window, meaning basically you need to have good information about your menstrual cycle, when you ovulate, and the signs. Okay, that's about knowing your body. If you're on family planning, you need to know when you're about to read, which period you're about to return according to the method that you are using. And this is dependent on an individual. Okay, so basically, we are talking about 5 tips that will maximize, okay, your natural conception as you are planning to conceive. So we've talked about stress management as well as knowing your bodies. We need to know our bodies. You need to know yourself as a person. A man needs to know their quality of the sperm. All right. The other point is about preparing our bodies. I won't say body, okay? Preparing our bodies. So, how do we prepare our bodies? Okay, how do we prepare our bodies? It's about staying active, You avoid being sedentary. Staying active, you shed off some weight. That is about weight management. It's not really about going to the gym, doing that, just doing minimal. You can do yoga, any exercise that has been prescribed, or any exercise that helps you. Even dancing these days, all those things are helping us maintain or lose our weight. You know, when you have too much subcutaneous tissue, what happens? You have low levels of progesterone and estrogen. All right, because you know there's poor blood supply when there's too much fat, even to the uterine tissues. Okay, meaning your uterus won't be able to prepare nicely because it's not well um, well prepared due to lack of blood supply to the uterine tissue. All right, what we're talking about, you need to prepare your body. The other thing is about dieting. Okay, when you're dieting, it's not really strict diet. Oh, you need to do this. Okay, when you go out there, there are a lot of things when it comes to dieting. So with me, dieting, I will talk about you avoid fish rich in mercury. Okay, you eat a food that are rich in folic. Okay, you eat diet that is rich in vitamin C. You eat diet that is also rich in vitamin D. Okay, proteins, vitamin C. All right, all this will help us with good blood supply, good progesterone and estrogen levels in our bodies. Okay, and when you come to folic, even it will prevent neural defects in the fetus that you conceive. Okay, so meaning it works well with also preparing a good DNA for that fetus. Okay, that's about preparing our bodies. What else do we talk about preparing our bodies? The other thing is about on the male part, on the dieting, they need to have good zinc quantities in the body. You need to have magnesium. You know, they help with blood supply to uterus. They help with progesterone levels. They help with basically hormonal hormones in our bodies. Okay, let's dive in on our uh, fourth uh, point. Okay, um, okay, we've talked. Let me go through again. We've talked about stress management. This is one of the tips. We've talked about knowing your bodies. We've talked about preparing our bodies. Where we're talking about dieting, exercising, and keeping active. Then we've talked about um, I will also discuss our fourth point, which is preconception services. This is huge. For me, being an African midwife, usually we receive few mothers coming for this service because basically it's believed for you to seek a service in maternal and child health, you need to be sick. You need to maybe to be seeking for maybe curative services like you're pregnant, you are suspecting a pregnancy, basically, preconception services, it's a wide range of services that is offered in this umbrella. One thing you'll be prescribed about folic, it will come in handy where you take about 5 grams weekly. 5 milligrams weekly, or rather, you'll be given zero point 0.4 milligrams daily. This will also help as we talk about neurological defects. You'll be put on vitamin D, which is about 400 international unit to 800 international unit in a day. You also do ultrasound to look at the uterine, where this fetus is going to be nurtured. How is it? We rule out uterine fibroids or in any growths. Okay, when you come for preconception services, they will check your bloods. They'll check your blood sugars to rule out insulin dependent diabetes. Okay, which will compromise the quality of fetus you're going to carry. We'll check your blood pressure to rule out preeclampsias or superimposed preeclampsia that will impede or come and alter the pregnancy of the progress of your pregnancy. Let's say we find these illnesses, talk about the BPs, talk about the diabetes, we'll manage it through. Okay, so when you come for those services, preconception services will tell you on how your diet as well. All those things are given by trained professions. So families, uh, partners, couples that are planning to conceive, please, we need you to our facilities to seek these services which are being underutilized, basically in Africa and respectively in my country, Zambia, being with 10 years experience in the nursing fraternity. I've seen this service is not really being sicked by uh, a lot of number of women um, in our country. Okay, then number fifth point. This one is huge. Things that you need to avoid in pregnancy, or sorry, when trying to maximize your natural conception. Let's avoid caffeine, too much of caffeine in our diet. Let's avoid spicy foods. Let's avoid mercury-rich fish. Okay, let's avoid alcohol. There's no amount of alcohol that is prescribed in pregnancy or in trying to conceive. All these will reduce. Do not, this one I'll say rates, I want to say let's reduce. No, this one is that to so do not smoke when trying to conceive. Do you know what nicotine does? Do you know what tar does? Do you know what the chemicals that are found in a cigarette does to you? Okay, it will constrict the blood vessels and there'll be reduced blood supply to the uterus. How will the uterus prepare? Okay. So those are the 5 tips, proven tips. It's not really about positioning. It's not about really putting a pillow below. It's not about lacing up your legs after having unprotected sexual intercourse so the sperm do not sip up. The sperms have to sip up. It's normal. Okay. So these are the proven tips. Watch your diet. Let's avoid sedentary life. Okay. It's not really going kuchilai. You're going for road runs or whatever that works for you. Okay, for me, I like dancing. Okay, and as an active midwife, all right. So these are the 5 tips that we've discussed that will help us maximize um, our natural conception. Okay, so kindly subscribe, like, comment. All right. These are educative points. When you comment, you make me improve on how I present. You make me improve on how I do my videos. Thank you so much. This has been your midwife, Cynthia from Midwifery and Me. Bye. See you next time.